Welcome to the Pharmacy Quality Solutions Quality Corner Show, where we believe that quality measurement leads to better outcomes. Let us become your go-to source for all things related to quality and medication use in healthcare. We will hit on trending health topics as they relate to performance measurements and find common ground for payers and practitioners. We will discuss how the Equip platform can help you with your performance goals, and we will also make sure to keep you up to date on pharmacy quality news. So buckle up and put your thinking cap on. The Quality Corner Show starts now.
Hello, Quality Corner Show listeners. This is your host, Nick Dorich, and today I am pleased to welcome you to an unexpected but exciting episode of the Quality Corner Show. If you listened to last week's episode, we noted that you would hear from us again in the new year, but surprise, we are back with a truly amazing topic for discussion and with a guest that is an amazing pharmacist, and I cannot wait for you to meet her. Let's get into the why of this special episode. On Monday, December 14th, Sandra Lindsay, a nurse at Long Island Jewish Medical Center, became the first American to receive the COVID vaccine outside of a clinical trial. Since that immunization was administered, patients in 4 priority groups have been receiving the vaccine. Those 4 priority groups include healthcare workers, frontline workers, people over 65, and people with pre-existing conditions. These priority groups are further broken down into subgroups for priority, for example, 1A, 1B, and 1C groupings. As vaccine administration has begun, the key recipients have been those working in hospitals and long-term care facilities thus far, and patients or individuals in those locations. Throughout the week of December 14th, I will admit that I was a bit overtaken by the amazing response of many healthcare workers that were sharing their experience about the COVID-19 vaccine. Like many of you, I saw personal friends and colleagues that were the first to receive the vaccine in their location. I saw friends and colleagues being the first to reconstitute the Pfizer vaccine. We may talk more about that later. And of course, I saw many pharmacists sharing their experience about administering the vaccine and their experience as many people were overwhelmed with this historic event. I'm going to slow myself down as I admit it's hard for me to remain objective with such an event. Before we continue, if you are a healthcare worker, a pharmacist that has been involved with these early stages of vaccine development, vaccine distribution, or administration, you have my sincere appreciation and gratitude. As I saw many of these social media posts and exclamations about this historic event, I reached out to a few friends and colleagues about their experience so far. While discussing this with one particular friend and colleague, we realized that this was a story that we needed to share, and this quickly morphed into a new and unexpected episode of the Quality Corner Show. So without further ado, I would like to welcome to the show Dr. Betsy Elswick. Betsy, welcome to the Quality Corner Show.
Thanks, Nick. I'm really happy to be here.
I've had the pleasure of knowing and working with Betsy through our mutual involvement with the American Pharmacist Association for a number of years. But for our audience, let's allow you to hear from Betsy or Dr. Elswick on her background and experience. Betsy, do you mind giving us a quick rundown or bio about yourself?
Yeah, sure, Nick. So I'm a pharmacist, graduated with my PharmD degree from West Virginia University School of Pharmacy. After I finished my degree, I went on to Virginia Commonwealth and did my community-based residency down there under the direction of Ralph Small at the time, and knew I wanted to come back to West Virginia. Anybody that knows me knows that I'm a proud, lifelong West Virginian. So I was able to come back and take on a faculty position at WVU, and I've been here since 2002. I was raised in a pharmacy family. My parents owned and operated an independent pharmacy in West Virginia for more than 40 years. So I have literally grown up in a pharmacy, and that's where I love to be. I currently direct 4 different community pharmacy residency sites and do a lot of outreach with community pharmacies, trying to help pharmacies in West Virginia develop and implement innovative services and just support them in any way that I can. And like you said, I am involved with APHA, American Pharmacist Association, a lot, trying to be a good voice for pharmacists in our profession nationwide, not just in West Virginia.
Excellent, Betsy. Thank you for that background. And with that, we're going to move into our discussion for today. And for those that are new to the Quality Corner show, our discussion will focus on three primary questions for our guest, that being today, Dr. Betsy Elswick. And we may have some back and forth with each discussion so that you, our listener, can understand the context and primary learning points. After those questions, we'll finish with a summary and a closing that is specially put together for our guest. Now for question one today, and before we begin, I would like to point out, as Betsy and I were preparing for this discussion, we would like to note that new information related to COVID-19 and the vaccines for COVID-19 are newly becoming available. So while we are recording this episode in mid to late December, we may reference CDC or ACIP guidelines that are relevant and active as of mid to late December. Those may change going forward. So we would recommend that you as a provider or you as a patient or just you as someone that's interested in this topic, that you do look at those CDC and ACIP updated guidelines whenever you may be hearing this, and that you also refer to your personal healthcare provider for more information. Now, as I'd mentioned in preparing this episode with Dr. Elswick, in the state of West Virginia, this was particularly of interest to speak with her because as of the day of our recording, the state of West Virginia has administered the highest percentage of available vaccines as compared to any other state in the United States. So what they're doing in that state has been particularly successful about getting patients, getting frontline workers to receive the COVID-19 vaccine. Now, with that, all of that background, we're now going to begin into question one. And the distribution and prioritization for the COVID vaccine has been highly regulated. And as we mentioned in the introduction, there are specific patient populations that have been prioritized for receiving the vaccine at these early stages. So question for you, Betsy, how did you and your team get involved with the COVID vaccine distribution, and what patient populations or healthcare providers have you been working with thus far?
Yeah, sure, Nick. So this has been a really interesting and exciting process. We got involved because our Governor Jim Justice, developed a plan whereby we would not only prioritize, obviously, getting vaccine to our hospitals and those frontline healthcare workers that need it, but also to our nursing home and long-term care facilities, their medical staff, their healthcare workers, and also their residents. West Virginia has the oldest median age in the country in terms of our population, and this is a population in our state, as with states nationwide, certainly, that have really suffered from COVID-19 and increased mortality if they do get it. So that plan by the governor then really we knew was going to involve a lot of people. You know, if we're vaccinating the hospitals and we're focusing on those frontline workers, who's going to do long-term care facilities and nursing homes? And immediately pharmacy came up, and particularly community pharmacy. So West Virginia, for those that haven't been here, we're a rural state. We have 55 counties, mountainous counties. They say if you would squash West Virginia out, we'd be larger than the size of Texas. And living here, I would say that's true. It's rural, it's mountainous. But we do have about 40% or a little bit more pharmacies in our state actually being local pharmacies, either smaller chains or independently owned community pharmacies. And we have great chains in our state too, but 40% of our pharmacies are actually more locally owned community pharmacies. So the governor really prioritized and said, look, we want all pharmacies in West Virginia to be involved in this. And so he asked that community pharmacists and pharmacies in West Virginia be given the opportunity to sign up to participate to help get those vaccines out to the nursing homes and long-term care populations that needed it badly. And so that's what happened. So pharmacists signed up, and then state leadership really started rolling with this, and they linked up pharmacies and nursing home and long-term care facilities based on the preference of the facility. And so in the pharmacy world, we know about pharmacy match for our residents. So this was a vaccine match. This was trying to make sure that facilities were paired with a pharmacy that maybe they'd worked with before, they were comfortable with, that were in maybe their hometown. That's also a great way to build trust, I think, between getting the vaccine and those residents. If they know their pharmacist, that's certainly a way that we can talk to those people So, long story short, we get a call about a week before last that says Sundale Nursing Home in Morgantown has actually selected WVU's School of Pharmacy. And we were ecstatic with that. We work with, community pharmacies through the state, but certainly we do have faculty, and we are trainers for APHA's Immunization Certificate Program. We have skilled clinicians that can do this. And so we were happy to be paired with them. So we said we'd love to participate, quickly put a team together, a small team of 6 of us, 4 faculty at that point and 2 residents. And I would have loved to have used some students too. We've been remote, and that was difficult for us because none of us had, I didn't have a student on rotation with me at the time, but for this first one, it was 4 faculty and 2 residents. And we kind of went from there. So what we saw, Nick, in the first 3 days of this program last week, I got the vaccine in my pharmacy Tuesday morning, 12:30. By 2 p.m., we were immunizing people. So we had a plan. We worked quickly. We were nimble. In the first 3 days, 14 local pharmacies throughout West Virginia administered nearly 5,500 doses of vaccine to more than 40 nursing home or long-term care facilities. And as of yesterday, Nick, the governor actually announced that West Virginia, like you said, had the highest administration rate of allocated doses of any state. In his noon press conference yesterday, he announced that we had administered already as a state, now this is hospitals and nursing home long-term care facilities, over 15,000 shots. We have a goal in our state. It's a lofty goal, but we're doing our best to meet it. All nursing home and long-term care facility staff and residents will receive the first dose of the vaccine by December 28th. We want this done by the new year.
Betsy, there's a couple of follow-up questions I want to hit on here just to confirm for our listeners, and because what you're doing in West Virginia and the experience of West Virginia has been pretty unique. It's been highly successful so far, which is great news. But this is early stages around vaccine distribution. Essentially, what your group did, and you can correct me on these details, but you essentially signed up working with the state to volunteer to be working on the vaccine distribution. You were paired with local facilities that were looking for pharmacists or other healthcare providers, and you essentially got a week ahead of time notice that you were going to need to be on location administering vaccine. Is that all correct as far as what the process has been thus far?
Yeah, that's pretty much been it. We said, sure, we'll help. And somebody wise really told me once, sometimes you just need to say yes and commit. And then you can't pass up an opportunity like this, certainly, and our profession can't. And so we said yes. And then we said, now what? And then we quickly filled that now what in.
Now, between that time where you said yes and the go live date, what was that work? What was that like for you and your team? Because I don't assume you just stayed home making popcorn, getting ready. I assume there was some background that you were getting into it. And I'll transition us to our second question now, because this ties together nicely. I'd like to discuss the data, the guidelines, and your preparation. Throughout the course of COVID, there's been much misinformation about the virus. There's been denial about the virus. There's been fallacies about treatment options or even cures for the virus. And the vaccine development has also certainly been dealing with some of this misinformation that's out there. So for you and your team, and as a pharmacist yourself, what information and resources made you feel comfortable about the COVID vaccine? And how did you get into that state of preparation to be involved with the process?
Sure. So, this was new information, and this stuff is coming out quickly, right? So, and we know we've got vaccine coming. We're told, hey, I think we found out on the Thursday or Friday before our first vaccine clinic, and we knew that the vaccine was going to be coming on potentially on Monday at that point. It didn't show up till Tuesday, but we knew that we potentially could have it on Monday. So I went into major study mode. I mean, it was like being in pharmacy school again. You're talking about popcorn. I think I actually did have popcorn because I didn't have time to make a dinner, so we popped some popcorn. But in terms of myths out there and debunking myths, I think pharmacists really play a critical role in helping provide that education and knowledge out into our communities. And as I started reading up and making sure that I was prepared to answer questions, my first question that I wanted to make sure I could understand was, what is this vaccine? What is this mRNA stuff? You learn about it in school, but how do you explain that? And so I kind of developed a way, and we all have our ways to explain things, but I think explaining it in simplistic terms to people, so that they understand how the vaccine works, what it does and what it doesn't do. So messenger RNA, mRNA, is that genetic molecule that this vaccine is based on. It's included inside a super, super small particle called a nanoparticle. And that's what I tell patients. It's a very, very small nanoparticle that acts as a messenger, just like its name would say, right? And it tells cells to go ahead and make the spike protein. And we all recognize what coronavirus now looks like. I mean, it's on Christmas ornaments. I've seen it on shirts. We recognize it by that spike. In simplistic terms, and again, this is simplistic, but I think of that spike as something that the virus uses to break into the cell's front door, which sets off your immune system's alarm, right? So think about having your house alarm set. And your immune system learns to detect and defend against that spike protein. And when it's presented with the intruder, meaning when it's presented with that infection. And I think if we explain that to people in that way, or something similar, I mean, this is simplistic, and I know, but I think that we can tell people, look, this is not going into your cell's nucleus. This is not changing your body's DNA. You're not going to wake up tomorrow looking like a different person. You may wake up with a sore arm, and some side effects, but this is not going to change who you are. And I think that's an important message to get out to people. And so as I was preparing to give the vaccine, certainly, I can't even tell you how many webinars I listened to. Thank heavens, we had ASHP, which is a National Pharmacy Association. We had our virtual mid-year meeting going on about the same time, and they had some wonderful sessions, late-breaking sessions with some wonderful folks. Even Dr. Anthony Fauci appeared at our meeting as one of the speakers. So I did everything that I could prepare. And I really just tried to dive in and learn about it through the FDA, through those EUAs as they come out, making sure you read those, front to back, CDC, FDA, manufacturer information.
Betsy, all great information there. I do have a couple of follow-up questions here that are important related to the vaccine. There's been a lot of information about this, or at least the two vaccines that have been approved at this point, one from Pfizer, one from Moderna, that these both being a two vaccinations needed. There's going to have to be a couple of weeks apart from that. Would like to get your thoughts on that, or just what you've seen, what you've been told, what you've read up on that part of it. And then a part that I'm also just curious about, differences between, I assume at this point, your team has only been working with the Pfizer vaccine, cold storage, reconstitution, what that's been like. But then with the Moderna vaccine becoming available, or as the next vaccine, there may be others down the line, but what has that been like so far?
Yeah, so we have just been working with Pfizer. Now, we were supposed to get a shipment of Moderna yesterday, and we've been told to expect that today, potentially tomorrow. So our next clinic, which could be this afternoon, as early as this afternoon, would be Moderna. They're both 2 injections, and they're both spaced about a month apart. Pfizer's saying 21 days apart. Moderna's is 4 weeks right now apart, but still, kind of close to each other, right? And both are really effective. I mean, if you asked me, which shot would I get? And I've had family members say, which one would you get? I feel perfectly secure with both of these vaccines and both of these companies. I would have no issue receiving either of these vaccines personally. I did receive the Pfizer vaccine last week because pharmacists are included in West Virginia's that 1A group. And because we're going into the nursing homes and high risk facilities, we need to make sure that our immunizers are protected. So I was blessed and fortunate to get that. Pfizer's is approved for 16 and up right now. Moderna's is 18. And I think, we'll see. Hopefully we're going to see, I'm hearing some chatter about maybe seeing younger ages included more soon, but hopefully that's something those pharmacists we need to just stay up on and just make sure that we understand what that age is. And side effects should be about the same. Both of these vaccines cause a little bit of your body is going to respond. It's going to mount an immune response. And so You may feel a little achy. You may feel a little, tired the next day, but that's not for everybody. Of 6 of us that got the shot last week out of our little immunizer group, I think this is interesting. Of course, it was only me, right? But I was the one that got just a little bit of a low-grade fever, And I have to tell you, Nick, I woke up and I was kind of excited because I thought, you know what? My body is mounting a response to this, and I'm not afraid. It's okay. I knew what to be aware of. I knew that it should resolve in about a day or 2, maybe 3. If it got any worse or didn't go away, then yeah, you think, gosh, was I exposed to the virus before I got the vaccine? Do I need to be tested? But my symptoms went away. It went away within 2 days. The 3rd day I woke up, my arm wasn't sore. I worked a 12-hour day and I felt fine.
Yeah. So Betsy, I want to explore that a little bit further for moving to our third question. This is going to be related to counseling and what to expect, how to work with patients on that part of it.
Yeah.
Over the weekend, I had a conversation with my father, who is not a healthcare provider. He does have 2 children, myself included, that are pharmacists, but he's not in healthcare. And when he was asking about, what's the vaccine going to be like? What should I expect? The analogy that I gave him, and my dad and I have a very close relationship based on the TV show Star Trek. And what I noted to him was that, getting the vaccine and your body's reaction, it's almost like when the USS Enterprise goes on red alert. It's essentially telling your body, be prepared. So you may have some ill effects from that. It's not that you are sick. It's your body reacting and being prepared to fight the virus. So that's a good thing, even if it doesn't feel good. Betsy, for our question, I do want to talk about, final question here. I do want to talk about these conversations, facts and realistic expectations, counseling points for patients. So what side effects could a patient be expecting when they receive the vaccine? You already touched on that a little bit. And with your experience thus far, what important counseling points, what education points should pharmacists reiterate? If you want to add any details, particularly as it relates to method of administration, I've heard a lot of pharmacy groups. I've seen a lot of information talking about, for pharmacists to really think and to recall their immunization training, the right way to administer these vaccines to make sure that we're limiting any adverse events based on improper vaccine administration. So do you mind providing any other thoughts you have on those topics?
Yeah, for sure. So what we want to encourage our patients to do is have a plan for their vaccine day and the day after. I think that that's helpful because you may be one of the ones like me that, you did feel a little crummy the next day, but it doesn't last long and it'll be okay. For most people, they're going to be just fine. They're going to have a sore arm when they wake up the next day. Now, what I would encourage pharmacists to ask their patients is this. Ask them which hand they write with. What is their non-dominant side of their body? So if I'm right-handed, as I am, I got the shot in my left arm. So if my left arm was a little sore the next day, it didn't impact anything I had to do. I think that is just a common sense thing we can talk to our patients about. There is no need, and patients should not pre-medicate with something like Benadryl or Tylenol or ibuprofen the day before. We don't have data necessarily on this COVID-19 vaccine and the impact of those medicines on our immune response, but we don't want to do anything that would potentially weaken it, right? We want to mount the biggest immune response to this vaccine for our body that we can. So I think to tell patients if they feel achy, they wake up the next day, they may feel like they have a very mild form. And I wouldn't say flu. To me, I just felt crummy. But I took a single dose of Tylenol and I started to feel better. I think I took maybe 2 doses that day throughout the day and felt just fine. But really this vaccine, when you think about the benefits of this vaccine and the opportunity we have to squash this thing, to flatten this curve, and to eliminate the word curve from our vocabulary with this virus, I mean, it's the right thing to do. It is, if anybody, and I said this before, but if you've ever wanted to do something for somebody else and you didn't know what to do, this is your time to do that. And I feel strongly about that.
Yeah, absolutely is, Betsy. I couldn't say it better myself. So thank you for the points there, the counseling, the recommendations. There's one other item here that I want to point out, and then we'll move to our closing. I've also seen a lot of information related to expanded safety monitoring systems for the COVID vaccine. And there are vaccine adverse event surveillance systems, but the CDC specifically has also launched vSafe, and that is a smartphone-based app where if you as a patient after vaccination, it's a health checker for people who have received a dose of the COVID-19 vaccine. vSafe uses text messaging and some web survey components from the CDC to check with vaccine recipients after receiving a dose of the vaccination. And it also provides second vaccine dose reminders if needed. And it can provide telephone calls for patients who may be experiencing adverse events from the vaccine. So as we're going forward, and Betsy, you noted this earlier, there is data, right, on the safety and efficacy for these vaccines, but we are still learning. So would also recommend, whether you're a patient, whether you're a provider, to continue to utilize some of these tracking systems and providing data, because that's how we get better information going forward. So Betsy, any other final thoughts or comments related to that?
Yeah, I signed up for that very text messaging service that you talked about, and it's called vSafe After Vaccination Health Checker. It sends me a quick little text message every day about the same time to see how I'm feeling. And if you note any side effects to the vaccine that would be of any severity, greater than what we would normally expect, you would get a call from the CDC or the vSafe tracking to make sure that you're doing okay. But this is important information. And I think if we can encourage our patients and then ourselves too, as we get the vaccines, to make sure that we answer it, it takes literally less than 2 minutes to fill out. It's super quick.
Super quick. And as we get more data, that can have a huge impact. So high impact, low amount of time spent. That's great. That's what we want to hit. With that, we have finished our primary questions for today. And Betsy, I have to express my sincere appreciation for you participating in today's talk. This has been really helpful, and I'm sure for our listeners and anybody out there that they'll also find this to be extremely useful as they're trying to understand the vaccine, be it with their coworkers, with their healthcare providers, and of course with patients. Before we do wrap up today's episode, I do have some final prompts for you, Betsy, and would like to get your thoughts. As I'm thinking about what we need to do and the road forward, there's really an opportunity here to showcase pharmacy. You provided a great example of pharmacy being on the forefront, improving patient care outcomes here, being an advocate for public health. And as I think about this really underscores the value that pharmacy adds to the healthcare ecosystem. And Betsy, if there's there's many things I know about you as through our professional experience working together. But if there's one thing I'd point out about that I know about you, it's your tireless experience of being a pharmacy advocate and really invigorating other pharmacists to be a change for patient care. So I'd like to hear from you, and with the experience so far on the COVID pandemic and vaccine administration, given efforts pharmacists have gone to improve health outcomes, what's next for pharmacy? What are our lessons learned from COVID? And once we're through the other side of COVID-19, what do we as pharmacists need to do so that patients are receiving optimal care and can be receiving other clinical services from pharmacists, not just during a pandemic, but on any day of the week?
Yeah, sure. Yeah, I'm a huge advocate for pharmacists' role in these healthcare teams and leading efforts amongst some of these healthcare teams. And certainly there's never been a time in my life that has shown the importance of involving pharmacists more as providers than right now. The only other time that I can think of is hearing some stories about the initial rollout of the polio vaccine or maybe smallpox, and looking to history for that. But for me in my life, this is it. In my small state of West Virginia, over half of our total vaccines have been administered by a pharmacist or student pharmacists and eventually technicians. And that really speaks to the fact that, we're accessible, we're trusted, we're so knowledgeable. It was interesting. We were at the nursing home the other day, and I asked one of the nurses if she wanted to help do some of the vaccines because we had close to 200 people that we had to pretty quickly get done. And she looked at me and she said, no, she said, I'm going to leave this to you. You're the expert. you're the expert on this with the reconstitution and the storage. And I think, taking this time, and I try to be pretty modest in life, but I think this is a moment to be proud of. I think, we shouldn't shy away from our role here and what we're doing. And with that comes, opportunities for things like payment and reimbursement. And we need to not be afraid to ask for that. We could not be doing this right now. And as more states roll out, I'm happy to be a support system, to folks that may need it. But we will not be able to do this without the pharmacist, in some ways leading the charge here and making sure that we're getting these vaccines to the people that need it, when they need it, and in a way that is safe and provides an effective means to squash this pandemic. So I appreciate the opportunity to talk about that.
Yeah, and thank you, Betsy. This has been, for us, a really great discussion, and I look forward to much more follow-up as we move forward in time. And for our listening audience, I want to kind of note that we were able to squeeze this conversation fairly early in the morning. Betsy noted that later this afternoon, she may be off to be administering more vaccinations and having more work to do. So also appreciate you, Betsy, sharing the time here. It points to your commitment to sharing good messaging, the importance that this does need to be talked about with other pharmacists, how they can get involved. We need to normalize those conversations around side effects, as you noted, what for patients, what they can expect, because the more that we're able to share this effective information and pharmacist involvement, the closer we can get to that finish line. And that's what we're all trying to do. Get past this rush from COVID-19. We want to be back to something that is I don't want to say the normal or new normal, anything else like that, but we want to get back to, functioning as we have previously and being able to work, be together in person, not having to maintain 6 feet of social distance at all times. That'll be nice. Betsy, before we do have you go, and again, really appreciate what you've provided today. You already said you'd be happy to talk with other folks if they have questions. So if someone does have a question for you about your experience with the COVID vaccine or any other topics related to pharmacy, how can someone reach or contact you?
Yeah, sure. The best way is email Nick. And I'm found through WVU School of Pharmacy's webpage. You can search my name. My email, I'd certainly be happy to give out my email. It's B Elswick, ELSWICK @HSC, which Health Sciences Center.wvu.edu. Appreciate you taking the opportunity and let me talk to folks today.
Yeah. Thank you, Betsy, for your commitment to patient care, to public health, and of course, to pharmacy. As a friend and colleague, I'm very excited to see Betsy sharing about her experience with COVID vaccine. And I also have to thank every pharmacist who has been part of the solution. There is more work to be completed, but we are on a path forward, and it is tremendous to say that pharmacists are actively part of the solution. Now, for the final time in 2020, I thank you, our listening audience, for being a part of the Quality Corner show. Please be sure to like or subscribe to the podcast, and please share with your friends. Sharing the great work by pharmacists helps show patients and other healthcare providers that pharmacists are an essential member of the healthcare team. We look forward to sharing more information about pharmacy, about medication use, and about quality in 2021. And with that, we do have one final message from the PQS team.
The Pharmacy Quality Solutions Quality Corner Show has a request for you. Our goal is to spread the word about how quality measurement can help improve health outcomes, and we need your help in sharing this podcast to friends and colleagues in the healthcare industry. We also want you to provide feedback, ask us questions, and suggest health topics you'd like to see covered. If you are a health expert and you want to contribute to the show or even talk on the show, please contact us. You can email info@pharmacyquality.com. Let us know what is on your mind, what we can address, so that you are fully informed. We want you to be able to provide the best care for your patients and members, and we wish all of you listeners out there well.